Namaste. Thank you for joining us today. We have Dr. Parimala Devi with us. She has 37 years of experience as an obstetrics and gynecologist. She has 21 years of experience in the field of preventive oncology, colposcopy. She is also a yoga teacher and evaluator with the Ministry of Ayush. And I'm so proud and happy and excited to have you here, ma'am.
Thank you. Thank you. Even me too. Me too.
Thank you. Thank you for taking time out for us. Presently, she's working with Fortis Group of Hospitals, Banargata Road. And also she has her own healthcare clinic, Dr. Parimala Healthcare, where she conducts a lot of preventive oncology cancer work. She has been practicing and promoting yoga for more than 3 decades now. And whenever patients come to her for treatment, she not only highlights the vaccines and the medicines they have to take, but also she recommends yoga to heal faster. Yes. So today we are here, and I am Kanupriya. I'm the founder of Yogini.live, where we help and support women in their wellness journey during pregnancy. So let's get started. Today, as a senior gynecologist, can you share your professional experience in working with expectant mothers?
Yes. Thank you, Kanupriya. It is a great moment for me to spread some messages regarding the health to all our friends, women friends, and also all the public who are having their families and who are really interested in the health of the women in their family. Expectant mothers, which is a good old the pregnancy care from our midwifery time, from the ancient time, where they would have a lot of home deliveries and all. The obstetrics part or the delivery part or the pregnancy part of the woman requires a special consideration. Whether it is in a village or it is in a city, pregnancy is pregnancy. The development is the same. The pregnancy, the conceiving, and the baby growing, and the pregnant woman carrying some of the problems. And especially when she lands in the delivery room, it is something that at most tensed moment for the family and a great responsibility for the obstetrician and her team, the midwives who are there, and also to bring to the world a new life. It's the newborn, what we say, bundle of joy. And I have been very lucky to for working for the medical college with the big number of deliveries, like about 1,000 deliveries per month, and also working for the villages also, where women would come in the large stage, and again we had to really be on our heels to settle them because no checkups, nothing. They would just come and land there. And also the other educated and high profile patients of corporate, where they are quite aware but still tensed, and they may have some metabolic diseases because of some problems in them. Elderly age groups conceiving these days because of the career and so many aspiring dreams. So all these things have given me a lot of experience, and at the end I have understood that pregnancy is a very beautiful blessing given by God to the woman. The womanhood is something very precious, and we all are proud. We women are proud because it is our speciality that we can conceive and we can give a baby to the world.
Because the baby is in the belly, it's growing in the abdomen, there's a lot of pressure on the heart, on the lungs,
Correct.
on the diaphragm.
Correct.
So
Correct.
also the body is like, overexerting. The heart is working harder to pump the blood.
Correct.
Lungs don't get enough space to breathe. So
Correct.
doing all these heart opening exercises, stretches, and all really help feel more energized, I feel, during
As
after.
we are telling, yoga gives all this stability and flexibility. In case of pregnancy, what happens? In pregnancy, the hormonal shift also happens. Hormonal surge happens. There is increase in the weight of the body, and there is, of course, the dilution of the blood system also. The hemopoietic system also enlarges. Everything will go for some hypertrophy, like physiological changes are so much. So the lady who is some 50 kgs will become nearly 10 to 12 kgs extra, and her nurse or whatever the blood vessels, everything, even her skin Starting from the skin to body, lot of changes will happen in each organs. To experience lot of happiness after a yoga, pursuing the yoga in our life, and generally also we tell our friends and people who are pursuing and who are very unaware of yoga what benefits are there compared to, they may tell why yoga only, we are going for gym, we are going for walking. Of course they have their own benefits, but yoga, it not only takes care of the physical health, it will take care of the mental health and emotional health also, and also added up spiritual health because of the meditation, shlokas, mantra, what we follow. This is generally, but when it comes to a pregnant lady, the advantages are much, much more, because in pregnancy, a woman body is undergoing lot of changes. It's a physiological process where there will be lot of dimensions of pregnancy, the tissues increasing in size, the muscles are also hypertrophying, and blood vessels, the neurological system, everything has its own expansion and developmental surges because of the hormonal surge which is going on in the body. The hormones like estrogen, progesterone in the woman, which are already there in a girl or a woman before pregnancy, are also again increasing in their quantity, especially the progesterone, and also the beta HCG, what we call as another pregnancy hormone, and also human placental lactogen, which is from the placenta. These are all getting produced from the pregnancy part, actually, from the fetal. This one growth is on one side. It is supported by the placenta. That is what we call it as masu, which usually falls off after the delivery. So all these hormones are produced, and they will create a hormonal shift, and also a lot of emotional instability also sometimes. And even this human placental lactogen is the one which is supposed to produce the gestational diabetes. These days, the researchers are proved that each individual has their tendency, and this placenta can produce human placental lactogen will be produced, but sometimes the concentration may be more, and those people may be more tendency. Like we have, for example, you might have come to know in your practice also when you're seeing patients that a lot of pregnant women in the very starting of the pregnancy, they have a lot of nausea, the vomiting sensation, what we call hyperemesis gravidarum. We say they cannot eat anything in the first 2 months. They really hate themselves, because a young girl who was very happy, bubbly, going around eating in the restaurant and coming and enjoying the life, suddenly becomes very crippled and feel that, oh, she is not able to eat anything. She is enjoying her pregnancy, that she is pregnant on one side, but she is not able to take her regular food, anything. This is all because of the progesterone hormone, which is surging, which is the pregnancy hormone, which is. So all these things will create so much of insecurity in some of the pregnant women, in the especially in the first 2 months or the 3 months. They are suddenly losing their liberty. They cannot go anywhere because everywhere the family is restricting them because they are pregnant naturally. Even the doctor also, after seeing, we tell, "Arey Baba, you should not jump." If the sports person also, in the beginning we say, you slow down your activities, slow down your movements. In the beginning, at least we say, even though the things may change after that. So because of all these things, a pregnant girl, a pregnant woman may go through a little bit of emotional instability, and she may have that flexibility of the body movements may be little less, and she may feel very tired because she is developing a lot of vitamin deficiency because of the vomiting, because of the pregnancy hormone, and also her body is increasing in the weight, especially after the first 3 months, and she may feel that her breasts are paining most of the time because it is secreting the milk, and she may lose all that, her color may little bit sometimes start developing pigmentation. So all these, some of the changes even in the skin, hairs, many things for the good also, but many things for the hormone also. She may feel little bit emotionally insecure, and she may feel little depressed. This is the time when yoga can make wonders in her life. If she starts practicing some of the asanas and some of the meditation processes. So if you, when you add up the yoga and some of the asanas and some of these meditation techniques, I think it will give a lot of emotional stability, flexibility, and that satisfaction, and to bear that endurance of going ahead with the pregnancy changes, I can say.
Yeah, we do a lot of visualizations, meditations, so which actually help mentally prepare the women to go through different stages of pregnancy, different stages of labor. So all these things, we do birth meditations, visualizations. That really helps, I think, because subconsciously we are putting the seed that you are healthy, the babies,
Yes,
everything is going to be fine. Because
correct,
to third trimester, I noticed that women get very scared. Sometimes they even
correct, correct.
they get very anxious, especially first time moms. They become very scared, like what is going to happen? This is going to be so painful, and it's a very scary thing for
Yes.
them.
Because of that, many of the young women, they don't want to go for pregnancy. They keep on postponing also. Even though their age is going ahead, still they are scared. Oh, what will happen? Pregnancy will push me totally into some kind of restrictive activities. Because usually most of the women these days are very active and they want to pursue their career. They feel that every liberation of that will be taken from them. They will have to be just restricted to the house only. They are not able to eat. All these things scare them, but this is the time like they have to pursue some of the yoga asanas and meditations which are very important, may not be in the first trimester, at least in the second and the third trimester. It's very important, I would say. Yeah, pelvic stretching, I think you can correct me. The pelvic stretching is very very important in the last trimester, right?
Yes, we do duck walk, we do all those pulsations, Kali asana. All those
Yes,
things are very beneficial because it helps strengthen the pelvic floor muscles. At the same
correct,
time, it helps in opening also. I
correct.
think it because women who do this regularly during third trimester, for them going through labor becomes easier. Otherwise, it is very difficult for those muscles to go through all that pressure during labor.
So for some of the patients, I just want to share my experience with you. They ask us, Madam, you are telling about yoga, but we are doing your walking and some of the other exercises like swimming. Some people are very fond of dancing. They may be dancers only professionally. Are these not exercises? Are doing the domestic work, the whatever the like bending and sweeping, everything? Are they not exercises? Yes, that's a very sensible question. If you are doing a walking, you can please do it, especially in the second trimester, third trimester. Some 20 minutes of walking, we also advise at least alternative because that will give a lot of cardiac health also. But along with that, if you can add up these yoga asanas, which will give a lot of stretchability to the muscles of the pelvis, because in the labor you are going to give a lot of energy and you have to push the baby for a normal delivery, especially you yourself have to push the baby with all your muscle power in the pelvis. There you have to have a relaxation of the pelvis and the cervix, whatever the mouth of the uterus have to open up by itself. For that, we are preparing the woman by giving these pelvic exercises. And there is a lot of lordosis at the back, that spine goes to that curvature. So
Yeah.
because of we may have a lot of backache also.
Yes.
So pregnancy and backache go hand in hand. Even after seventh month, no,
Yes.
many of the women they will come with backache and all those things because they have put on weight also. That is also another added thing. So
Also,
there,
I tell them, like, with the belly growing, the center of the body changes.
correct,
No?
correct. Lordosis.
Yeah.
Lordosis, they walk like a lord, isn't it? So
Yeah.
because of that, some of the exercises for the bending exercises like Padahastasana or
Support.
gentle chair asana, chair position, what we say, and all these things are definitely going to say like a cow position we say, and that bird position, all these things. But in the bird position, again, you have to be careful because they are on the abdomen exercises. We cannot tell them. And we have said even duck asana. Duck asana is something very good for pelvic relaxation and for the normal delivery, we say. But how much they can take and do is also individual capacity. We cannot force.
Yes.
We cannot force, right?
I always tell my clients that do as much as your body allows you to do. Do not copy anybody else in the class. Do not even
Correct.
copy me.
Correct.
If your body says that this is painful for you, immediately get back and sit, you know. And
Yes.
I always use a lot of props, like you mentioned,
Correct.
chair, blocks, birthing ball. I always use a lot of props because during pregnancy, it is very essential that you support your extremities, you support your knees, you support your hands.
Correct.
Like during
Correct.
cat cow pose, I always use blocks. I always tell my clients to use blocks because it gives more space for the belly. In
Correct. Correct. Correct.
So it is always good to have a chair nearby while
Correct.
asana. Sometimes when they're not feeling that well, I tell them to sit in the bed and do the sitting asanas. You don't have to every time come on the mat. So it is
Correct.
very gentle, very nurturing, very the yoga that I take is very soothing, very comfortable for the woman. I don't expect them to do anything uncomfortable, and I never ask them to try anything new.
Correct.
If they
Correct.
have
We should.
done, yeah, if they have not done some
Nothing in force, nothing in force, like we cannot force. If at all, they can do some few asanas only, like a stretching for just twisting a bit, and also just bending padahastasana and butterfly asana. That much is more than enough. That can help them in a lot of ability to push the baby to have a normal delivery. This ball exercises, what you said, like the birthing ball, where they sit on that big balloon type and they move the body, tilt the body. That is also very important. That can be something very reachable, like it is not a costly thing or anything. That can be adopted by the patient and they can definitely help themselves. But all should be done under the supervision of a yoga mentor and with the consultation of a doctor, because some women these days, as they are getting in pregnancy after 30, 32, 35, because of so many reasons, there can be hypertension, there can be diabetes. So few things are to be consulted by a doctor and then they should proceed.
Yeah, sometimes, like I've heard my own cousin, when she was pregnant, she had gestational diabetes, and the doctor immediately told her not to do anything, just
Yes,
go for a walk, don't do any yoga. But there are some pranayams, like I
yes,
shared with her, Sheetali, Sheetkari
yes,
pranayam, mudras that she can practice
yes, yes,
besides her working. So
yes,
yoga, people think is just asanas,
yes,
but it
yes,
is more than asana. It is
yes,
also your mudras. It is also pranayam. It is also meditation.
yes.
So just cutting away from yoga and just going on walks and doing your other things is also, I think, not very beneficial in the long run. I think pregnant women can get help even if they have specific conditions. What is your
Yeah.
take?
Yes, yes, definitely they can have. Just going back retrospectively, people who have not conceived also have been helped by yoga, by pursuing yoga for few months. Suddenly their menstruation become very normal, their egg liberation becomes very normal, and they conceive in no time. That is also one group of people are there. All these things will definitely give her lot of that confidence. Oh, I am prepared for this delivery. I can definitely deliver my baby very happily and in a healthy way. This confidence, what it gives, will make her go through this saga for delivery very smoothly. And she will be able to give the baby her milk production, everything also after the delivery very well, because she has been relaxed. So her hormonal level also will get stabilized, we can say.
Yes, definitely. I feel, yeah, Garb Sanskar is all about inculcating, positive qualities in the baby even before the baby is born, right?
Correct,
So,
correct. Yeah.
yeah, it is a very powerful thing because babies can, I think you know it better, babies can start to hear, listen
Correct,
sounds,
correct.
I think from fifth month.
Yeah, yeah. From sixth month, we can say. Yeah. Fifth month it starts, but by sixth month, there will be almost everything they will be able to hear it. So we tell the women, pregnant women, please listen to all good things. Don't get involved in all bad negative thoughts and
Hmm.
listen to some spiritual things. And shub shub bolo. You should just listen
Instrumental
all shub
music.
shub.
Yeah, yeah, yeah. Listen to a lot of instrumental music, Mozart,
Yes,
things
yes.
like this that will improve the brain, the
Correct, correct. The brain development, the emotional cognition power.
yes, yes.
And we say like babies which are brought up with good samskar, this garbha samskar or this one, they'll be really very productive citizens of the future. Like their development itself will start in the womb.
Hmm.
The development doesn't start after they come to the world or from the labor room. It has started from the womb only, in the uterus only.
Anything that you want to tell women who are watching this podcast and wondering if they should join prenatal yoga?
Actually, there will be lot of benefits of emotional benefits, and the sanskar also starts changing. You will become more healthy. So the benefits of yoga are many, and they should pursue yoga, asanas, and also meditation technologies from the second trimester only.
Thank you so much, Dr. Parimala Devi, for taking time out with us and sharing your thoughts and sharing your invaluable experience with us on this platform. We are very grateful. And I don't know if our audience knows, but I would like to definitely share that Dr. Parimala is a Guinness record holder for the highest number of pap smears done in a day.
There is another passion of me, preventing the cancers in women, preventive oncology.
Yeah. So
I'm blessed. I am blessed by him.
Yes, thank you so much, Doctor, for sharing and taking time out from your busy schedule for this. And we look forward to having you here and maybe discuss something more interesting for our audience someday.
Yes.
Thank you again.
Thank you. Thank you.